Welcome to Ashley on CBD, your one-stop podcast where we drop the truth on all things CBD and maybe some pop culture too. Stick around as we delve deep into the practical health benefits of CBD for you.
Welcome to the show. Thank you for listening. Today's episode, as always, is brought to you by Magic Immuna Tea, available at packedwithlife.com. What could be more important in today's world than having a strong immune system? Probably nothing. But how do you do that? Diet, exercise? Well, no kidding. But what I've recently started doing is drinking Magic Immuna Tea. Number one, it tastes great, and it's loaded with healthy nutrients called adaptogens, including 4 essential mushrooms, reishi, lion's mane, chaga, and cordyceps. No, not the magic kind, you guys. Come on. Reishi, lion's mane, chaga, and cordyceps are great for you. Highly nutritious and very adept at boosting your immune system. So give Magic Immuna Tea a try at packedwithlife.com. Today's guest is Dr. Becky Lynn, MD, from St. Louis. And we're focused our conversation with Dr. Lynn on women's health today, and specifically how it pertains to cannabis and CBD and women's sexual health. So I hope you enjoyed the show.
Hi, how are you?
Good. How are you?
Good. Can you hear me okay?
I can.
Awesome. Well, happy Thanksgiving.
Thanks. You too.
Well, yeah, thanks for joining us on this day after Thanksgiving. I appreciate you taking the time. It's really nice to meet you. Fascinated to talk to you in terms of your specific area of expertise when it comes to cannabis and CBD. Very different than most of the folks we talk with. So hopefully we'll be able to shed a lot of light for the listeners and help educate some folks around cannabis and sexual function.
Sure.
Is that accurate?
That's pretty accurate.
So tell us a little bit about yourself to get started. How did you get interested in the cannabis dimension as an MD? I mean, I'm always intrigued by that.
Mm-hmm. So I'm a gynecologist, and I specialize in menopause and sexual health and sexual problems in women. So low libido, painful sex, difficulty with orgasm. And the whole cannabis thing sort of fell into my lap. It was back in 2015. I was seeing many women for sexual problems, and I had a number of women come to me and say, I have this problem with libido, or I have a problem with orgasm, but when I use marijuana, it gets better. And so it just made me a little bit curious. I wanted to know, is there any truth to that? And if so, what's the idea behind it? And so what I did is I went to the medical literature, published medical studies, and there really was not much. Because it's been illegal. So there was very few. There were no like high quality studies, because you can't do that and have a control group and a group that gets marijuana and then evaluate their sexual function. There were a couple questionnaires, which are inherently not great studies, because it depends on there's so many areas where you may just not remember exactly what things felt like when you did that. And then there were a handful of animal studies, so rats and hamsters and things like that. So then I went to the internet to see what I could find, and there were plenty of websites that said cannabis is the greatest thing since sliced bread when it comes to sex, and you should try it and all this. So I was working for St. Louis University at the time, and in Missouri at that time, all marijuana was illegal. Medical marijuana is now legal in Missouri. I'm in St. Louis, but when I was doing this, was all illegal. So we designed a questionnaire to evaluate women's perceptions of the sexual experience when they smoked marijuana beforehand. And we asked people how they used marijuana. Was it, edibles or smoking or vaping? And the majority said smoking. So our questionnaire looked at several domains of sexual function. We looked at the overall sexual experience, sex drive, lubrication, pain, and orgasm. And what we found was that the majority of the women who, and basically the group that we looked at, I worked in a big, busy OBGYN office, was anybody who walked into that office, no matter how young, how old, well, they had to be above 18, but they could be pregnant, non-pregnant. It was just, you know, a representative sample of the women that came to our clinic. And so we did find, I'll get back to the findings, that the majority of women reported an improved sexual experience overall, improved orgasm, improved drive, less pain, and really not much difference in lubrication. And we talked to almost 400 women, 300 plus women. So it was a pretty big sample when we did that. We have also now completed a second study, but it's not published yet, and it's still with the statistician, looking at women's perceptions of the sexual experience in a group of women with sexual problems. So I'm anxiously awaiting that information and kind of curious what we're going to find. So it definitely just fell in my lap. And it was kind of good timing because, you know, there was such a movement in Missouri for medical marijuana. And during the time that I was doing all this, it passed. So it's been very interesting.
Now, were these folks that were being studied, was this marijuana use directly before sex, or was it marijuana use in general, and therefore you're more relaxed as a person and sex naturally is better, or both? It
was before sex. That's specifically what we asked. Yeah.
Okay.
And so we compared several groups also. So we separated into people who didn't smoke marijuana, people who smoked marijuana, but it wasn't part of sex usually, and then people who used specifically before sex. And we did find that people who used marijuana before sex had twice as high chance of reporting good orgasms in their life in general.
Wow. That's a big deal, right? So,
it is. The media loves that one.
Well, I mean, just as much attention as gets paid to male sexual health, right? I mean, I have a pharmaceutical background. I used to be in that world, and I'm very familiar with DTC drug advertising, specifically in the male erectile dysfunction area. I spent a lot of time there. So it's, you know, there's a lot of money that's been spent in that regard, right? Mm-hmm. So what you're talking about here is pretty revolutionary stuff, right? Mm-hmm. What kind of reception are you getting?
Oh, well, when my study came out, I was called by a lot of, and I've never been in this position, but a lot of people called and wanted to interview me and talk about the study. It definitely has caught on. And it's, you know, I have a 16-year-old daughter this was on like 2 nights ago, and she was scrolling through her phone, and she knows what my research is about. And she saw some study on cannabis, and she was reading it on the internet, not like a published medical study. And it said a gynecologist in St. Louis. And she was like, that's my mom. So it's kind of funny. It's definitely gotten traction. I'm very interested in it. And since then, I have created there's a course that I was going to do it live, but now it's all recorded through cannabinoid medicine studies on women's health and marijuana, or in cannabinoids in general, not just marijuana. And I have learned so much more about, you know, how it works in the body and how it affects pregnancy, what we know and what we don't know, and lactation and fertility and the menstrual cycle. I just feel like, you know, there's a lot of potential with cannabinoids because the receptors that they bind to in the body are all over, and they're concentrated in the reproductive tract. So there's a lot that we don't know, but I kind of think now with, you know, states legalizing it, it's becoming, you know, more acceptable to do studies on it. Before you could, but it was very difficult. You could only use a strain of cannabis that came from a farm in Kentucky, which is not anything that anybody's actually using. So, you know, I just feel like the world is our oyster in what we're going to learn in the future. And I see it already all around me, just how many more studies are coming out, how many researchers are looking into all the possibilities for medical marijuana.
So do you have any hypotheses at this point as to why it's working for women so well, or how it's working, or both?
Yeah. So for the sex realm, I think it works for a variety of reasons. I think one, it does now. Well, let me preface this by saying it's not going to make sex fantastic in every situation with every person. You have to be in a comfortable situation with somebody that you trust. I certainly don't recommend this to everybody in every situation, and definitely not children. Definitely not. Um, but in the right situation with the right person or by yourself, I think it lowers anxiety. And having treated women with sexual problems, I think anxiety plays a huge role when it comes to pain and when it comes to orgasm. But even just with the libido, if you're a little nervous about things, it can lower your anxiety. I think it slows down the perception of time, and it heightens all of your senses. So that feeling of touch and taste and smell, like I think it just heightens your senses and makes everything seem so much bigger in your brain.
Mm-hmm. Well, that's generally what it does in life, right? And just so it makes sense, I guess, that would transfer into sex. So what, any part of, I know you haven't done the studies yet or so much, but are you looking at all at men's health as part of this too, to see if there's similar reaction, or are you staying focused on women at this point?
So I'm just staying focused on women. I used to be full-time at St. Louis University. Now I'm an adjunct professor there, and I have my own private practice in Missouri. And when I was full-time at SLU, I had reached out to one of the urologists who had an interest in men's health. And we talked about doing something together, but we never got on it. And I can't do it myself because I am not a men's sexual health expert by no means. None of my patients are men. So I don't know if he's like had any desire to go down that route, but I don't treat men or see men, so I'm kind of useless when it comes to that.
Yeah, I went to Indiana University a long time ago, but I know they've really had a lot of leadership experience in the area of sexual health for men and women. So I don't know if there's is there anybody there working on anything similar to what you're looking at, or do you know?
Not that I know of. Since my paper was published, there's been a couple more papers, but I can't remember off the top of my head where they're coming from. I want to say one was like maybe Stanford, but I'm not 100% sure.
Right. So what's next for you in terms of exploring this further? I mean, how do you hope to, I guess, gather the support to explore more clinical testing? Is that where your mind is?
Well, so my immediate project is I'm working with a couple people, and we are writing a review of the effects of cannabinoids on pelvic pain. Because I think that is a huge window of opportunity. Like I mentioned, there's a lot of receptors for cannabinoids in the reproductive tract. And one of the places where it shows some promise, maybe we don't know because we don't have enough data yet, is in women with endometriosis. And endometriosis causes chronic pelvic pain. When it gets bad, it's horrible. So what endometriosis is, where the endometrium, or the tissue that lines the uterus, what women shed each month with a period, can be implanted in the pelvis, on the bladder, on the bowel, on the pelvic sidewall, and it causes inflammation, and it causes terrible pain, and it causes painful sex. And there is some preliminary thought and very preliminary data that cannabinoids might help with pain due to endometriosis. So we're in the process of looking at all the literature and writing a review of what we know on how cannabinoids affect pelvic pain, because there's really good data. There is data on pain in general and cannabinoids. It's, at least in Missouri, chronic pain is one of the diagnoses that you can use to say that someone is able to use medical marijuana. So we know that it works for pain. So with this review, we're sort of honing in on chronic pelvic pain. I don't have anything like my questionnaires that I did in the works at this point, mainly because I'm not full-time academics anymore. So to do a big study is a lot more complicated. But I'm definitely working on the paper with chronic pelvic pain.
And in that regard, are you looking or thinking, is your hypothesis that it could be CBD or THC or both, or does it matter to you in your research?
Yeah. So CBD does have it's an analgesic also. So, and I don't know what the right answer is. Is it CBD or is it cannabis, or is it a combination of both? And my suspicion is that probably a combination of both, because they potentiate each other. And if you mix CBD and THC, maybe you don't have to use as much THC. And when you think about medical marijuana, it's different from recreational marijuana. The goal isn't to get stoned. The goal is to use as little as you need to have an effect on whatever you're treating. So it's not to get high. And so, that's part of the reason I think that THC and CBD combined will probably pan out in the future. Well, it remains to be seen. One place I do use CBD, and this is totally not based on data, like data that's published, is I see a lot of women with chronic pelvic pain and vulvodynia. And so vulvodynia is pain on the vulva, and there's no reason for it. It's not a yeast infection. It's not that you used the wrong soap or detergent or something like that. Some women have chronic pain of the vulva, and as you can imagine, it's horrifying, and so there's a variety of reasons that happens, but I have a couple patients who have been treated with everything and gone everywhere, the Mayo Clinic and Northwestern, and like with all the tried and true treatments that we haven't gotten better. And so, I was talking to one, this all just got started because there are CBD lubes out there, and there are CBD suppositories and things like that. And I said, because of what I know about cannabis and marijuana and cannabinoids, I said, there's a CBD lube. I don't know if it's going to help you, but it's pretty benign from a reputable company. And so my one patient who was seriously had tried everything, it's been going on for years, she tried the CBD lube and she loved it, and it helped her pain so much. So it's totally anecdotal, because you don't know that it's really the CBD in the lube. It could be the other stuff that's in the lube too. But so we tried it with another chronic pelvic pain patient, and she said it took her pain from an 8 on a pain scale to a 2. And so I'm just like, and I don't know if we can't prove that it's the CBD, but knowing what I know about CBD, I'm excited to see where that goes. And I do know that there is a trial going on the East Coast. A friend of mine is looking at a CBD lube for vulvodynia. And I was reading about how CBD works, and CBD works by binding to the same receptor as capsaicin. So capsaicin, I don't know if you know much about capsaicin. It comes from peppers, and it hurts like hell, but it's supposed to help with pain. And what's that?
Strong anti-inflammatory.
Yeah. So I never, it's a known treatment for vulvodynia, but I've never had the courage to use it, because what I've heard, like when you first put it on, it burns like crazy. So I've never used it. But I read somewhere that CBD binds to the same receptor as capsaicin, which is a known treatment for vulvodynia. Wow. So I was like, ooh, maybe it's going to work. Who knows? But I definitely see the potential in it.
No, that's great. That's thanks for sharing that logic too around why you think things are working. Because without studies, we don't really know, right? But it's okay to make hypotheses based with experience and professional judgment like you have. So thank you for sharing that. What else could you share with us that I haven't asked you about? What's on your mind?
What is on my mind?
I mean, you're there in St. Louis, right? So in Missouri, the legalization status is medical. Is that correct?
Just medical, but I know there's a big movement to make recreational marijuana legal. And actually, it was passed in 2018 on the November ballot, and the first dispensaries just opened in Missouri within the last month or so. So I'm interested to see where it goes. So
what are you looking for when you advise your patients from a quality standpoint? What what do you advise them? You referenced earlier from a reputable company, right?
Yeah. So, so I know a couple vendors that I trust. And what I've read and heard is that, the FDA has gone and tested some of these online CBD products, right? And so, one group that they tested had no CBD and no THC. Another group that was sold as CBD really had THC in it. And so, and I see these places, even right now, I'm actually in Los Angeles visiting my parents. Maybe I shouldn't say that online, but we're stuck at home. So, I see like just down the street, there's like just stores. Well, in California, it's all legal. But I've worked with a couple of vendors that I trust, and I go with that, and they have, and I don't remember the designation. I don't remember it off the top of my head that says they're reputable.
Certifications that you're looking for that people.
Yes. Yeah.
A very common one is the U.S. Hemp Authority certification. That's one that,
yes,
that I refer people to look for that when they're looking for CBD.
Yeah. And the thing with CBD is if you look on the internet, it says it fixes everything. And there is nothing in this world that fixes everything. So I think people have to be careful with that. It's not the answer to everything. And the thing is also, because it's over the counter, it doesn't have to undergo the rigorous testing that medicines have to undergo, and it's not regulated like from being the pharmaceutical industry, how tightly regulated. When you get your prescription, you know exactly what's in it. It's exactly the same as the bottle you're going to get next month. But with these over-the-counter things, they're really not well regulated at all. So you have to be careful. And I feel like there's a lot of false advertising and marketing claims about everything that CBD does. And so to be careful what you read, I think.
Yeah, I think that's great and great advice. And thank you so much for your time today. It's been a pleasure meeting you and getting to know you a bit here. Let's stay in touch for sure. I'm excited to see where your research goes, and
Sure.
Best of luck. And thank you for doing what you're doing for women.
Thank you for having me. It was fun.
Okay. Have a great weekend. Thank you.
All right.
Bye-bye.
Thank you for listening to today's show. Always brought to you by Magic Immunity Tea, available at packedwithlife.com. A mushroom tea that tastes great. Try it. Magic Immunity Tea, packedwithlife.com.